Hello, colleagues. I'm Dr. Rajiv Kovil. I'm a diabetologist in Mumbai and have two diabetes centers in the western suburbs of Mumbai. Welcome to this month's edition of Diabetes News Nucleus. Diabetes News Nucleus is an initiative of MedTalks and it has been supported by Mankind Pharma. What we do in Diabetes News Nucleus and our endeavor is to get the latest in research, the latest in drug trials, the latest in trends in healthcare in the metabolic space to your doorstep. So our endeavor has always been to bring you the latest during this pandemic, and I believe in the last three editions we have been fairly successful. Now let's look at the headlines which has captured everybody's imagination in the metabolic space in the last 30 days. COVID and COVID pandemic has actually governed our lives over the last 7 to 8 months. And what latest data tells us is that the hospital admission, the blood glucose on hospital admission, actually predicts the outcome of patients. So irrespective of whether the patient was a diabetic or not, the blood glucose at hospital admission predicts overall mortality and also predicts the severity in non-critical patients with COVID-19. So this is data coming from Spain. It's a registry of almost 11,000 patients with COVID-19. And what it shows is that patients whose blood glucose on admission is more than 180 are at almost two times at higher risk to have a worse outcome, which could be going on to a ventilator or probably having mortality as compared to patients whose blood glucose are normal. And when they split these cohorts, they found that the patients with admission blood glucose of more than 180 had a 41% risk of all-cause mortality as compared to 31% with patients between a blood glucose of 140 to 180 and 15% of blood glucose of less than 140. So as the hyperglycemia goes up, all-cause mortality and severity keeps going up, irrespective of diabetic status. So inpatient hyperglycemia is something we all need to treat. Another thing which is making news this particular month is a study which is done on actually rodent models, mouse models, where they have shown that hyperglycemia or high blood glucose actually increases the virulence of MRSA. So MRSA has always been a pathogenic organism in many of the infections with diabetes, whether it's related to diabetic foot or is related to diabetic UTI or genitourinary infections and many other skin and soft tissue infections. And this data, which is obviously done in mouse models, tells us that hyperglycemia actually impairs what is called as respiratory burst. Neutrophils and macrophages make use of respiratory burst as a defense mechanism. And this utilizes glucose and also makes use of a lot of glucose transporters like GLUT1 and GLUT3. And in streptozotocin induced diabetic mouse models, it was seen that hyperglycemia impairs this ability and makes it more prone to MRSA infection. That's why we see a lot of MRSA infection in patients with type 2 and type 1 diabetes. Another study which was published this year again looks at a cohort of pre-diabetic patients who were followed up for 8 years, and we have been globally. We know that we have close to almost in India. We know we have 77 million diabetics, and we have an equal number of pre-diabetics who are very hungry to become diabetics, and it is a global, it is a medical, social, and economic need of all of us to come together to prevent the progression from pre-diabetes to diabetes. And there have been a lot of cohorts which have been studied globally on how we can prevent the progression from pre-diabetes to diabetes. Well, one such cohort has been studied and was what's published on almost 11,000, almost 1,000 patients with pre-diabetes. And what it showed is that close to 3 to 4 kilogram weight loss and a modest amount of physical activities was able to prevent progression from pre-diabetes to diabetes. So again, it's extremely important to emphasize the importance of lifestyle measures in our patients who are pre-diabetics and make sure that they do not progress to diabetes, because we all know that these metabolic abnormalities which are there in patients with diabetes actually actually run the cardiovascular and the chronic kidney disease epidemic globally. Now let's come to the topic of the day or the topic of the month. It's our proud privilege to have Dr. Sujoy Ghosh with us. Sujoy Ghosh comes from Calcutta and he has a rich experience of the last few decades. He's a professor in the endocrine department in the Institute of Postgraduate Education and Research in Calcutta. Welcome, Dr. Sujoy Ghosh. Welcome to this episode of Diabetes News Nucleus. And the topic of this month is something that we all have been affected with in the last 6 to 8 months, and everybody globally has been suddenly gone into the whole domain of hygiene and immunity. And what we have seen is that diabetes and patients with diabetes have been one of the highest risk factor for adverse outcomes when it comes to an infection, especially something like influenza and COVID-19 mortality and morbidity. And this has raised a lot of eyebrows across the globe. So our topic today is that are patients with diabetes at risk, and how does diabetes, as being something related to sugar, how does that affect immunity? So my first question to you is, are patients with diabetes more prone to infection? Is it an immunodeficient disorder?
Right. Thank you very much, Dr. Kovil, for that wonderful question that you put forward. If and you were talking about COVID-19 as well. So you mentioned that this is an increased risk factor for poorer outcomes in COVID, or for that matter, any infection. Now, when we look at that, I think we need to break it up into bits and pieces. There's one bit that if you have diabetes, you're more likely to have complications, whether you're talking about organ dysfunction, whether it's micro or macrovascular complications, which obviously any infection you have, it's going to be more difficult for that individual to cope with. So the organ dysfunction because of the background diabetes is one reason. The second would be the acute hyperglycemia itself would cause certain problems. You've already talked about the study that he quoted from Spain, that blood glucose level, even in the non-diabetic individuals, would possibly modify outcomes. And here probably comes in one of the questions that you've asked is, does hyperglycemia per se alter immunity? Now, the word immunity to a layman is kind of a very loose term that we often tend to use. There are many, many facets to it. One is what we call the innate immunity, and one is the acquired immunity, and there's the B cell immunity and the T cell immunity. So, for example, when we are now talking about vaccines, we are more interested in B cell mediated immunity. The T cell mediated immunity is what would have prevented the primary infection in the first place. So when we are talking about immunity, primarily let us talk about B cell immunity, T cell immunity, and the pathways through which the body tends to fight infection. Different kinds of organisms trigger different kinds of immune responses. And the challenge and the problem is the difficulty of measuring these processes in someone within his body. So in vivo studies are going to be very difficult to conduct. So most of the data that we have are in vitro studies. So for example, you would have taken out blood from an individual, looked at the mononuclear cells from the buffy coat after centrifuging the blood, and look at white cell function, for example. Or you would indirectly measure certain cytokines that the body would be producing against, in terms of response to an infection. And that's how you would come up and say, whether there's alterations in immune function. From most of the in vitro studies predominantly, and of course from outcome studies, we realize that diabetes is an immunodeficiency state. Now, the mere fact that you have diabetes does not mean you're immunodeficient. If you have uncontrolled hyperglycemia, particularly for a long period of time, or detected for the first time because your body hasn't had an opportunity to cope at all to the changes, your immune function is going to be altered. You'll be more susceptible to infections. And if you do catch an infection, it's more likely to progress, will take longer to heal, and will be associated with poorer outcomes. And there are various postulated mechanisms that also we can talk about.
Thank you so much, Dr. Sujay. Another thing is that a lot of patients with diabetes are obviously prone to infection, but somehow infection has not been considered as always being a complication of diabetes. The ADA recognized it a few years back, but micro and macrovascular is what we always focus on, and infection is left behind. And many a time, patients do not realize the importance. So doctors who are listening to us now, is there any way they could grade patients that who is at high risk? As you said, hyperglycemia for a longer period is surely a risk factor for any kind of an infection. But is there any way they could grade? Is there any way one can prevent? Because infection is a huge. You've got the demons across all the systems. So is there any way one can actually?
Right.
Uh,
I think you've made a very valid point. For example, if you read textbooks and look at diabetic foot ulcers, they tend to classify it as neuropathic ulcers and vascular ulcers and mixed ulcers. Now, in India, I think a doctor will start classifying it as an infected ulcer versus a non-infected ulcer, because whatever the underlying etiology in diabetic foot ulcer in India would be, the ones that you and I see that have gone bad are actually the ones that are infected. And therefore, the mere presence of infection or the mere risk of infection is not good enough to say, or stratify whether this guy is going to go into a bad problem or the other. So the underlying organ that you're talking about, apart from the hyperglycemia per se, you're going to look at the underlying organ function as well. So you're going to look at what's the blood flow of the place that I'm looking at. Is the vascular supply good enough there? Do I have a problem of offloading? So that would be, say, for example, for the foot. For example, on the other hand, if you are looking at a genital infection, you'd be trying to look at, is this individual circumcised? Does this individual have any obstructive uropathy? Because that's going to increase the risk of that infection. Is there any autonomic dysfunction of the bladder? Is there any renal stone which is blocking up? Is there a hydronephrosis? So depending on each of the organs that we are talking about and each of the infections that we are talking about, you are going to look at the physiological functioning as well as the anatomical obstructive pathologies, if there are any, along with the susceptible organisms and the environment from which these organisms are picked up. For example, if somebody is admitted in hospital, there's a whole lot of list of hospital-acquired infections that you are again worried about. And depending upon your normal physical ability scores and your glycemic control and the drugs that you take, of course, because some of them would make you more susceptible. For example, an SGLT2 will make you more susceptible to a drug, for example, like the genitourinary tract infections. So, and concurrent medication as well. If you're on steroids, if you've got a background malignancy, so all of these would add up to your risk factors of increasing chances. Like you said, infection is a complication of diabetes.
Thank you so much, Dr. Ghosh. Another thing is that doctors across India have been bombarded by patients who are consuming everything to improve the immunity, and they feel it's a quick fix. People are consuming vitamin C, vitamin D, all kinds of mixtures, and they just want to prevent this one infection. No. On a broader perspective, what would be your suggestion to doctors listening to you, that how do we improve the immunity of the nation?
Right. I think the first step is education. You look at any product that's selling on or being advertised on television, kills 99.9% of COVID. Whether it's plywood, whether it's your honey or whatever it is, it's gone to a pretty ridiculous level. Let us understand like I said, it's very difficult to test efficacy of improvement of immune system, because the methods of assessing immune function itself is very difficult, because these are mostly in vitro studies, animal model studies. We really do not know. For example, vitamin D, vitamin C, these have all been shown in vitro studies to do something to the immune system, to boost the immune system. But actually, it's not translated into any clinical benefit in any RCT anywhere on earth. So technically speaking, we cannot recommend anything specific as an immunity booster for whatever we are talking about, whether it's COVID or otherwise. But let us follow common sense. So if we think hyperglycemia worsens the immune function of our body, because there's enough evidence to show that there's alteration of the neutrophilic function, the macrophage function, the T lymphocyte function, the cytokine response, get your sugars down to normal. That would be the most important thing. Get your blood sugars down to normal. Control your blood glucose level. Optimize your organ functions. So, for example, don't let your kidneys go from bad to worse. Try to stabilize whatever organ dysfunction you have and achieve good glycemic control. So, I think the most important thing would be to uh, optimize the blood glucose control. And if your blood glucose levels are well controlled, if you've taken care of your organ dysfunctions, because that's very important, you just can't let your heart work badly or your kidneys go off, then you are probably going to have the best chance of surviving any infection that we are talking about. And of course, start treatment early if you do catch an infection, particularly the bacterial infections. If you wait too long, you might actually lose the battle, because particularly the signs and symptoms of infection and inflammation might be masked in individuals with diabetes. So, for example, what you are thinking of as an innocuous foot infection can actually progress very rapidly and cause a lot of damage. So, I think people with diabetes need to be extra careful so that whenever they have any minimal suspicion of any infection, they seek medical help early and take the proper antibiotic and for the proper dose and for the proper period of time, because often we find people treating suboptimally and things recurring thereafter. And remember, particularly if you have a urinary tract infection in diabetes, the treatment might need to be prolonged, which might be months together actually. And again, bone infection in diabetes is going to be again a big challenge. Tuberculosis and diabetes is again a very common combination. There again, please adhere to treatment. Otherwise, you will land up with MDR-TB.
I'm taking off from where you left off that pulmonary tuberculosis has been one of the most opportunistic infection in patients with diabetes, and the poor compliance of patients with the AKT and it being an opportunistic infection has still not actually opened the eyes of so many of us who are practicing clinicians globally, that diabetes seems to be a risk factor for most opportunistic infections. So coming to my question, uh, patients with long-standing diabetes, the elderlies, patients with comorbid conditions, patients who have had some form of malignancy, patients with transplantation. These are higher risks of diabetics, and patients with comorbid conditions also. Do you think that all of them should ideally be immunized against all vaccine preventable disorders, whether it's pneumonia, it's influenza, hepatitis B, maybe even shingles, and so on and so forth? Do you think that now that hygiene and immunity is going to be in as a priority in majority of clinics, do you think that that should be something that we should always consider?
I think at least COVID has taught us that now people are vaccine aware. You know, when we used to talk to our patients about pneumococcal vaccination, to our patients with diabetes, people used to think that this is something fancy, this is something ancillary, which is not essential or part of the management protocol. The American Diabetes Association has had this as part of their treatment protocol for quite a few years. The CDC has recommended it. I think even in the Indian guidelines, the first few guidelines that we had did not have any mention of vaccines. Now, if you look at the new 2019 ESI RSSDI guideline, you now have that section on vaccination. And I think vaccination is very important. And particularly in India, I think we have underplayed the importance of these vaccines. As if people have thought, vaccines are for kids, they are not necessarily for adults. So every possible disorder that you can possibly avoid by vaccination at the right time, particularly influenza annually and the pneumococcal vaccination, both the different strains that we tend to use, I would recommend that people actually go and take those vaccines, because that might go a long way, particularly in the elderly with organ dysfunction, to prevent problems. And if you're thinking of, transplantation, like you talked about, hepatitis B is also going to be a very, very important.
Last question, Sujay, to all the doctors who are listening to you, what would be your take home message to them that how what in what ways can they spread the whole message in the whole community on how to prevent infections and improve immunity in the longer run. We Indians are used to learning swimming when we start drowning. So, how do we improve the immunity of the nation per se?
I think at every point of contact that the doctor comes with the patient, he now needs to emphasize the role of preventive medicine. It's not just about hygiene, all aspects of preventive medicine. People are now more willing, I think, at least to listen to you.
Thank you so much, Dr. Ghosh. In a nutshell, he said that this is the right time to make a socio-cultural change in habits. Unless we change habits, we don't change a lot of outcomes. And today, probably patients may be more receptive to change in habits than ever before. Thank you so much for an enlightening discussion on a topic which is not so often discussed and not so often, I would say, dissected in detail as you did. Thank you so much, Dr. Sujay Ghosh, for being here with us.